Hi, everybody. Welcome to this week's Unfiltered Counseling. I'm Dr. Kelly Avritt.
I'm Dr. John Avritt.
We're glad you're here. We're going to start like we always start. Tell me something good.
Tell you something good. Hunt the good stuff.
Yeah.
So for those that have not seen previous episodes, we like to start these off with some hunt the good stuff. It's our counterbalance to fight or flight system. It's our intentional way of pointing out the good things in our lives. It's really important. We can wire ourselves to be more optimistic. And so mine this week, for those who don't know anything about me, I like to work out. I like to go to the gym. I like to drag you there with me. But I do get set in my ways. And as I've gotten older, as you know, I've gotten more inflexible, not only mentally, but physically
inflexible.
Certainly physically inflexible.
Because you're beefy, babe.
No, just no.
Mm-hmm. It's because you're beefy.
Is that it?
It is.
I think I'm getting older.
I watch you not be able to stretch your arms over your head.
Yeah.
Like
well,
you're stuck.
As we get older, flexibility is important. So even though I have a background in coaching and a background in kinesiology, I think that I've been hard-headed in seeking other people's opinions. But this week, I decided to step outside that comfort zone and use my character trait of curiosity to my benefit. And so I reached out to somebody. I sat in on a coaching call, and I actually got really excited about what I learned and decided I've hired a flexibility coach.
Nice.
And so I'm proud of myself for...
I'm proud of you.
Yeah, thank you. For spreading out a little bit, expanding my knowledge, tapping into curiosity, and taking on the perspectives of somebody else. And that's my good stuff this week. Thanks,
good
babe.
work.
That's my good stuff this
Good.
week. What about you? What is your good stuff this week?
Well, so over the weekend, we had a little bit of a long weekend, and I said, babe, I need you to hang this curtain rod up because I have all these canvases that I've been working on and they're not finished and they can't lay down because they've got, and you were like, well, maybe if you would just finish one, then we wouldn't have to find a way to hang them. So I did. I finished a couple of pieces this weekend, and it was nice.
They're beautiful.
Thank you.
Your art is beautiful.
Thank you. It's unique for sure.
Well, it's all the art in our counseling office, and all of the art in our house, it comes from you. So your stuff is pretty amazing.
Thank you. But I also was learning. I was doing foil for the first time, and it's hard because it doesn't quite behave. But I had a good time.
Why is that? Why is finishing art projects important to you? Like, why is this your good stuff this week?
Because I think anything left undone in your head kind of bothers.
Yeah.
It bothers me anyway. And that's just the way I'm made. So I'm like thinking, I've really got to get back to that, or I'm on a deadline and I need to finish that, and we have a new office space that we're having an expansion office space that we have to kind of decorate. And so that was my impetus for that. But
cool. Yeah,
it was nice.
It's amazing. I'm looking forward
to
hanging it.
But you know how it is with my art. Like unless it has a purpose, it just sits there.
Yeah.
So that's kind of part of it.
Yeah, I think generally as humans, we don't like unfinished stories.
Mm-mm.
We don't like to not read the last chapter of a book, or we get irritated if a series we're binge watching ends on a cliffhanger,
right?
And
for sure.
Then that season doesn't get renewed.
Yeah,
and you're like, what the hell?
Yeah,
right. What happened to so and so? Back in the day when we went to the movie theater more often, and a film would break, and they would send you home because they couldn't fix it, and you're like, but what about the ending of that movie?
Yeah.
And if there was no internet back then you had no way to know. So we just generally don't like unfinished stories.
It's true. It is true.
I'm glad you got to finish. They're amazing.
Thank you.
Yeah.
Thank you. So speaking of the gym, I had a thought. So we were in the gym.
We love it and we hate it, but we generally love it. Okay, that's just me.
I mostly hate it.
Yes.
Okay, mostly hate it. But I like the way it makes me look, and it's the time that we get to spend together, so I do it.
Yeah. Thanks.
Definitely not the thing that I'm like, let me get up and run there. No.
Yeah.
But I do like the effects, so I engage. But I digress.
Yes.
The whole purpose of me bringing that up was because last time we were in the gym, I was wearing the
Heroic
Heroic
Hearts Project.
Hearts Project T-shirt that says "Ask me about ketamine for veterans." And so I was I was at the cable machine or whatever, and some guy comes over to me and was like, "Hey, can you tell me about ketamine?" And I was like, "Sure, but that's the guy over there." And so I drag you over there, and he has questions, and so we have a quick little chat, and hopefully he'll call. But it reminded me of, there are a lot of people still have questions. There's a lot about ketamine that, even though we have IV clinics, different places, and you see these pop up everywhere. There's still a lot of questions. People still have there's some misinformation out there, and some misperceptions about it.
There's
and
a
so
myth
I thought,
out there, for sure.
Yeah, for sure.
Yeah.
And so I thought it would be worth talking about today.
Yeah. Agreed.
So
it's an important topic.
Let's just talk about why ketamine. Because I remember the first time you mentioned psychedelic psychotherapy, I said, "Oh hell, I'm not sure." You've lost it. Like, you are the most straight-laced person ever.
Yeah, true.
Never done a drug in his life.
Correct.
And so, or at least besides alcohol, right? You've drank, but other than that, no drugs. So when you come home and are like, "Hey, I got to tell you about this psychedelic psychotherapy," I was like, "Oh."
Closest I've ever been to drugs is like a hairband concert.
It's true.
Right.
Where you inhaled.
What's that smell?
Okay. Yeah,
that's
true.
it. So you're right.
You didn't inhale.
No, I held my breath the entire concert, 100%.
For sure.
Sure. So you're right. I think this is an important topic that needs to be talked about. I think more and more and more people are seeing ads for ketamine and psychedelic therapy on Instagram, TikTok, Facebook. And, you look at it once and you know how that goes on
the
your
algorithm
social media.
gets
The
you.
algorithm says, game on. I'm going to send you these all the time, right? And so it's something that I know in the field of counseling that can be tremendously effective. It's not something I considered 15 years ago, because I didn't understand it then. But now veterans, and especially us being around the veteran population, veterans are at the forefront of psychedelic research.
Sure.
And I think what I learned was that all of plant-based psychedelics, and I want to take out the word psychedelic, just plant-based medicines, been around forever, hundreds of years.
Before Christ, yes.
Yeah, yes, thousands of years then, right? I mean, plant-based medicines is what we had. And these plant-based medicines in the late 1800s and early 1900s were being developed for mental health, physical health, to fix our ailments. Then penicillin's discovered, aspirin's created, pharmaceutical companies take over, and
Nixon makes it illegal in
Nixon
1973.
makes it illegal, and profit-based pharmaceutical models are created.
Right.
And spiritual psychedelic aids are now outlawed because we're separating the pharmacology from the spiritual, from something that could be organic and gotten by everyone. We're not doing that anymore.
And just to add on to that, plant medicines, there was a little threat there, right? Because you have the ability to not be dependent on other medications that way.
Right.
I mean, I know you're going to get to that, but I think that's kind of
that's
rub there. Big
the profit
pharma rub.
threat. The profit threat.
Yeah, for sure.
And I think, in the psychedelic world, it's seen as hippie, underground, abusive.
It did go underground.
Too spiritual. And that was not looked at very favorably in those generations, the 50s, 60s, 70s, and into the 80s. And that's why culture kind of split. But I point to, and this is somebody that I was surprised to hear from at a conference in June, former governor of Texas, Rick Perry, was a speaker at a psychedelic conference. And those that don't remember him or know of him, He's one of the most conservative governors in the history of Texas.
And was at the forefront of the war on drugs in
Correct.
Texas. Like
He
it was
grew
a
up
thing.
like he was like a believer, like a lot of people. Drugs are bad. We all remember the egg in the frying pan commercials from the 80s.
Right.
And drugs are bad. Therefore, people that do drugs are bad. And so as a governor and with that kind of power, we need to outlaw the war on drugs. It is a great campaign slogan. It helps get people elected. What also helps people get elected, support from pharmaceutical companies.
Sure.
Pumping millions of dollars into campaigns. So the war on illegal drugs supports the war on legal drugs. And that's what you're talking about. Psychedelic plant-based medicine can be curative, especially in the world of mental health.
Mm-hmm.
That's not helpful for pharmaceutical companies that
who want you
are
on Lexapro for the rest of your
correct,
life, or
who are telling you that if you want to be somewhat
Wellbutrin.
normal or feel somewhat okay, you must take this pill every day for the rest of your life, and it's not meant to be curative. And psychedelics are changing that landscape. So I knew when we opened our current practice, like we want people to get over stuff, right? We want people to get unstuck and move on and feel like they can be the kind of people they want to be, right?
Yeah. One of the things that I saw Rick Perry speak not very long ago about if he was going to put his name next to ibogaine, because that's the
ibogaine, the iboga plant, big deal.
That's that was the tipping point for him.
Yeah.
He had a friend who was living in the governor's mansion.
Yeah.
I don't know the name. Tell us.
Marcus Luttrell.
Marcus Luttrell,
Yeah,
that's
living
right.
in the governor's mansion. Yeah.
Yeah. And was just paralyzed, I guess, and tormented
Right.
by PTSD.
Right.
Experience.
A lot of combat trauma.
Yeah. And so what I heard Rick Perry say was, I was not putting my name next to it until I tried it. I wanted to see what this was really like and what this would really be.
Right.
So let's talk about your experience with ketamine.
Yeah. So I kind of felt the same way, like, in my research, because I knew I wanted to explore this in our office. But I didn't want to, and I can explain a little bit why I chose the route that we deliver ketamine, why I chose that route.
Yeah, let's do that.
Let's do that first before my own.
Before
okay.
your.
Yeah, sure. Okay, so when I first started doing the research, the first thing that I found was S-ketamine.
Mm-hmm.
It's a smaller dose nasal spray. It's called Spravato. It's the brand that is out there. And look, from a clinical standpoint, from a medical model, private practice who wants to stay in business, looking at other medical models that are out there, wellness centers where you can go get your weight loss injections, your Botox injections, your peptides, where it's not quite drive-through medicine where you drive in, get it, and drive home, low T clinics, all of those things. That model is very profitable. Often they're cash only. You get the help you need. You don't need to spend a lot of time talking to somebody. You go in, you get what you need, and you go out, and there's results. Okay, great model for profit and for helping people. Clinics that wanted to start to invest in psychedelics, many clinics tried to operate from that model. Spravato was one of those choices. So again, an option. Option two and three, IV clinics and intramuscular injections. You can get ketamine both of those ways. We, as a clinic, were not set up to have someone that was capable of doing either one of those, right? That takes a licensure that we did not have in the office at that time. But I found a company called Journey Clinical, and they have the fourth delivery option, which is a sublingual tablet. Sometimes it's a lozenge, but it goes under the tongue, it dissolves, you swish it, and then you get your ketamine that way, the delivery, which we'll talk about the effect in a minute. That fit our model because the client can meet with the provider and the prescriber and then get it, and then we can facilitate it. I didn't what my ultimate goal has been, and what clients and patients need to consider, if you are on anti-anxiety meds, antidepressants, any medication that you have to take for multiple years, and someone says to you, hey, you take this just to feel better, when's it going to work? When's it going to cure you? If you had a sinus infection and you went to your primary care, you're going to get some antibiotics and you're going to feel better, and you can stop
Should
taking
be
the
14
antibiotics.
days at least. Like by the
Right.
time we're done with
Exactly.
the antibiotics, we should
Yes.
feel better.
Unless you have the sinus infections I get,
Okay, then maybe a little longer.
it might be a little longer. But the medical model says go to the doctor, get medicine, and be cured.
Mm-hmm.
But not when it comes to depression. We're going to give you a drug that keeps you
Flat. I go with flat.
Dull is the word I hear a lot.
You don't have highs, you don't have
Yeah,
lows.
right.
Flat.
Which is great for some people because their emotions are a roller coaster, and you never have this big build and then the fall off a cliff feeling on an SSRI antidepressant. I didn't want that for my office. Our goal when people come in is to feel better, not to feel flat, dull. I don't want that. So we decided to give it a try. And the results have been amazing. I think patients need to be very careful about how they choose this method.
But ketamine is specifically for treatment-resistant PTSD, depression, anxiety, or does that not matter? I mean, that's kind of how it was touted.
We're finding that can be broader in scope. Originally, yes, there are some markers, some screenings, if you will, where you must have failed, and I quote unquote failed, 2 treatment options. Tried medicine A, didn't work. Tried medicine B, didn't work. The issue for me with that is if you're going to take a medicine, antidepressant, okay, anti-anxiety med, and you go to your primary care, they basically have a list of medications to give you. It's like a janitor's set of keys. Yeah,
There's a protocol.
Yeah. They got their favorites, for whatever reason they've established their favorites, and they have a janitor's set of keys. You are the lock, but they don't know necessarily which key opens the lock. So let's try key number 1, my favorite. Doesn't work. Let's try key number 2. Doesn't work. You're wasting 1 month, 2 months, 3 months at a time trying to see if this medication works. Now you've wasted 6 months to a year, maybe even longer, and you give up on it. You become hopeless, and you
Makes it worse.
Yeah. So
sometimes.
So back to the question: is it ketamine just for these certain things? Do you have to be a combat veteran to get psychedelics? Do you have to be a first responder to see stuff? Do you have to have gone through something traumatic in your life? The answer is no. I think anybody can benefit from psychedelic medication. We're finding that it's extremely helpful in addictions. It's extremely helpful even in
curbing addiction.
Yes.
Which would be counter.
Because something led to the addiction,
Sure.
right? So we're looking at that. And I want to be real careful that I'm not saying that ketamine fixes trauma, fixes anxiety, fixes depression, fixes addiction. Doesn't fix anything. And we'll get into that, but it's not a fix. It's not the key necessarily that unlocks everything and now you're better. Okay, it's not an antibiotic. Okay, but we're seeing that it's useful in end of life care, acceptance of death, changing perspectives, changing mindsets, changing your thought patterns, helping you adjust that default mode network, that counterproductive thought pattern that you have. It disrupts that pattern. So there's a lot of disruptive thought patterns that humans have.
Sure.
So we're finding that psychedelics can kind of open our minds up to a whole lot more than just specifically I've had trauma or I've had some event in my life that I'm depressed about.
So I've heard you describe it as, ketamine's the tool.
Yeah.
But you're still the carpenter.
Absolutely.
And so I think one of the things that I want you to talk about is, I've had people tell me, well, I went to an IV ketamine clinic. It didn't help me at all.
Yeah.
or I've tried that didn't work.
Right.
And so maybe dive a little bit more into
Sure.
why that didn't work and
Yeah.
why our model maybe is a little bit
Yeah.
more productive.
Yeah. Great question. Because I think with the increase in advertising and what people see on social media, they think they can treat it like Botox, go get it, and your face looks better, or whatever the reason is, or low T, I go get a shot
Well,
and I feel better.
I think that's the
right?
way we've been conditioned. You just
100%.
explained it, right? You go to
100%.
the doctor, you get a medication, it should fix you.
Correct.
And I think, let me just say, you do feel better.
You do feel better. Yes.
You have elevated mood.
Right.
You do feel better.
Right.
But did you really get rid of or address the issue
Correct.
that you really have been struggling with, the underlying
Right.
cause, right?
Right.
So that's
Yeah. So let's kind of the gold standard here of psychedelics. And this is if you go to an ayahuasca retreat, if you go down to Mexico and do an ibogaine experience, a psilocybin mushroom
in Colorado or Oregon.
Yeah, yeah, or other places that but
it's legal there, is what I'm
it's
trying.
legal. It's legal there.
I'm
Yeah. Legal
legal
places, legal places, or stumble into something that may not be legal in your location of choice. However, there's some things to understand, okay, so that you get the experience that you're wanting. First of all, you're absolutely right. Ketamine is just a tool. You are the carpenter. The hammer is not going to work by itself. You have to tell the hammer what to do. I really like, and I reference your analogy here about being an artist. Ketamine is the paint, okay? And there is the paint, but you are the artist. You have to paint the canvas of your life. Ketamine's not going to do that for you. Otherwise, it's just fucking paint, right?
Sure.
You are the one, when you're in your art studio, are telling that paint and that brush what to create. So ketamine is that, right? It's the paint, it's the tool, but you, the individual, have to be the one creating. So when I say whatever your psychedelic of choice is, ketamine, which is what we can all get legally prescribed to us right now, everywhere. Psilocybin, if you go to a retreat or ceremony, ayahuasca ceremonies, ibogaine ceremonies, it's an event, right?
It's
and
a
you've always
ceremony.
said, yeah, it's a ceremony, but it's more than just a one-off. It's more than just you show up and you take the medicine and you have what we call the flight, this experience. It's an event. It's a 3-day event, a 4-day event, meaning you have to do some prep work. You have to do some post-integrative work. What are your intentions? For us in what we do with ketamine, what are your intentions? And we have, as a therapist, I have conversations with my patients and ask them, what are our intentions? Our gentle compass directions. Where are we headed? Not what we're fixing. We don't. I want to fix my depression. I want to fix my addiction. I want to fix my marriage. I want to fix. That's an expectation. We're not setting an expectation. We're setting a gentle compass intention, a direction of where I'm curious about how to improve my marriage. I'm curious why I have these thought patterns. I am open to the idea of new perspectives. So we're opening this person's mind, and the patient has to open their mind to the possibilities. After the flight, in the days that follow, often called right afterwards the golden hour of neuroplasticity and the neuroplastic window that opens after you have a psychedelic experience, that's where integration. I often look at it as a triangle. We start with an intention. What is the direction we're headed? What is the curiosity that I want to explore? What is the world I want to see differently? How I want to see the world differently? Then we go on this flight. Did my flight respond to my intention? From the flight, and my neuroplastic window begins, I integrate. I talk to somebody. Did my flight tell me anything? Did it reveal anything? It doesn't matter if you don't understand it right away. You may not understand it when it happens. You may not understand what was revealed in the weeks after it happened. It may take several dosing sessions to connect all these pieces. But integration is part of that. It's integrative therapy. So is your integration purposeful with your flight? And then is integration then therefore connecting to your intention? This triangular process of change that's facilitated by paint, the tool.
So,
And it may take several dosing sessions.
yes, it
Several.
usually, typically, logistically, you are going to meet with the
Yeah.
nurse practitioner,
Yeah.
establish a dose,
Yeah.
and then
That's where back to what your original statement about these IV clinics. Sorry to go.
it's okay. I'm getting you back. Here
You're
we go.
bringing me back,
Bringing
right?
you back.
Bring me back to that question. But like, if you find on Instagram or TikTok or Facebook, IV clinic here, intermuscular clinic there, and you can go, oftentimes they are not your therapist. Okay. So it's extremely important to understand that if you're going to do this on your own, you must understand the process of intentions, journaling, self-reflection, self-awareness, understand what to expect. Because if you go, you're not going to get a lot of that explanation from some of these clinics who are living in the medical model of come in, get your stuff, and come out and go out. You have to understand what ketamine is going to do to your brain, what is going on in your brain from a neural perspective, and what ketamine will do to your brain. And is that something that you want, this dissociative effect? And then who are you going to integrate with afterwards? Right? Are you just going to let it be? You will have an immediate antidepressant effect by
You
doing
will have
it.
an elevated mood.
You
for
will have
sure.
an elevated mood. You will distance yourself from whatever pain you're feeling. You will distance yourself from it and have a good hard look at it, but you won't feel it for a brief time. But without integrating, you can't stack critical learning windows, neuroplastic windows on top of each other, extending that distance between your pain and having some understanding without integrating with someone that you might have a therapist over here and go get ketamine over there. But that person is integral in this process. The way we do it and the way I've been trained through research and through Journey Clinical, my association with Journey has been, I'm the one that's going to prep you for it. We're going to talk about intentions. I'm right there with you when you dose and take flight. And I'm right there with you during the integrative process. That way you have this same person that you trust, that you've shared things with, that's right there with you, that's going to make sure you're okay no matter what.
I think that part is extremely valuable because you already have a relationship with that person. You know what baggage they have. You know they have baggage and it's not Louis Vuitton.
Right.
Okay. And so you are able to, when things pop up that maybe they don't notice or in flight they saw, because you know them, because you have a relationship, you can help make those connections maybe that they wouldn't be able to do had they gone and gotten kind of juiced up in a way and then gone off and done it themselves. Now, some people are pretty evolved and can maybe do that on their own or maybe have some coping mechanisms that allow them to integrate. But I think that's challenging.
It is. You know, those people you speak of that can do it on their own, those people have already researched, already studied, and already have a history of understanding what the psychedelic process is.
Sure.
But there's many that don't, and many that see this on the internet, and they're like, "What is this? What is this stuff? This is foreign to me."
Because they've heard of Special K.
Right,
That's
right.
you
Well,
can get
right.
it illegally,
Right,
right?
right. Well,
so that's
I'm
the
already-
thing.
yeah,
They're like, "Oh, I want
exactly.
to be high."
Well, that
And
group
that's-
is already fighting the myth, like
Yeah.
I had, like Governor Perry had,
Yeah.
that people that do drugs are bad. Right?
Right.
Drugs are bad, and people that do drugs are bad. And they're like, "You mean I'm going to go take the horse tranquilizer?" I'm like, "But you don't weigh I'm not going to give you the horse dose, so calm down. Like a
Well,
horse weighs what?
we're
Two,
just-
I
we're
don't
not-
know. You're the horse woman, like 2,000 pounds.
It's on this
Yeah.
side of the K-hole, okay?
Well-
We're just
well,
on this
but
side
here's
of
the
it. We're
thing.
not getting in it.
Well, my answer to that myth that's out there about, oh my God, this is the horse tranquilizer is very simple. One, you don't weigh as much as a horse,
right?
so I'm not going to give you that dose.
Mhm.
Two, horses are just as sensitive as humans.
100%. And we're not
So-
trying to trank you.
So that's ketamine is chosen for that reason. Horses are just as sensitive. The second part is that it's going to be dosed to your weight, dosed to your need. Now, doses adjust over time,
They do.
right? We are not going, ketamine is a dissociative anesthetic. It was designed for the battlefield in Vietnam so that the separation from pain gets soldiers to safety, right? And you hear, like, We Love the Pit, great show, right? We hear Noah Wiley, Dr. Robbie, when a patient comes in, we hear the word ketamine come out of his
Sure.
mouth, right? He may not know what it means, but he's a good actor. But it's in the ER setting, it's used for something different. And it's not the same dose that we deliver in the mental health space,
Right.
right? We're kind of
And the
in between.
modality of being
Correct.
a lozenge, you're not going to
Correct.
get it's not
Correct.
It's not like that.
Correct. Correct.
and
Absolutely.
you spit. You said you
So the
put
way
it
we do it,
you
yeah.
swish, but you end up
Yeah, so the way we
That's
do
the
it with
part.
the lozenge is it dissolves, you swish it, it absorbs through the mouth, and then you spit it. If you
Whatever's left.
swallow it, which I've heard is an option by some, we don't believe in doing that.
we don't practice that.
The
but-
swallowing of that dissolved ketamine extends the anesthesia effect afterwards.
Mhm.
You may not recover physically. If you've ever had surgery before and you know what that's like in the 30-minute, 60-minute, 90-minute window afterwards, you may not be able to walk under your own power.
Sure.
It's not going to harm you long term in any way. It doesn't taste great to swallow it, but some people do swallow it accidentally
Mhm.
because they've already had this psychedelic flight already take hold. But that's not our method.
Right.
But our method is to be there from start to finish with somebody.
And I think that's what makes ketamine appealing.
Yeah.
Because it is not, ceremonies can last, with psilocybin, maybe it's a 6 to 8 hour event, right? Or, several days. You've mentioned that. So over several days. Ketamine is not that way.
No.
You come in, takes about 45 minutes to an hour
Yeah.
flight time.
Right. Right.
And then you're able to move on with your day.
Yeah, ketamine, as far as like if you were to analyze and really dive into like what psychedelic is for you, ketamine, about a 2-hour block of your day with your facilitator, your therapist. When I say it's a multi-day event for ketamine, what I'm referring to is like the day before, prep your body. Don't drink alcohol. If you're a weed smoker, stop. Like hold on for a couple of days, right? Prep your body, eat right. Don't eat a lot of heavy foods. Don't, if you're prone to getting heartburn, like I am from drinking a lot of sodas, maybe don't. The day of, start your journaling, start your process, like mentally focusing yourself into this world. And then the days after, you don't need to screen like right afterwards. Like you're in this what's called neuroplastic window where your neurons in your brain are like, let's go. We're ready for action. We're ready to be rewired. We are ready to be reconnected. We're just like when we were
They're
babies.
primed. They're primed.
They're primed,
for
yeah.
New
So, like-
learning. If you want to learn a language, do it during then.
Yeah, that's the fascinating part, right? Like in clinical trials of ketamine, obviously students are often at the forefront of volunteering for clinical trials
Yes.
for some extra money.
Yes.
A lot of them were learning languages in music and calculus, and these students learned it better and faster under these protocols.
Because of the
Because
neuroplastic
the
window.
neuroplasticity that's available with ketamine.
So that neuroplastic window is about 7 days.
Yeah, we kind of look at it between seven to 10 days, this neuroplastic window. That's the perfect opportunity to come back. So we call it leapfrogging. Our process is this week you dose, right? The following week you integrate with therapy. The week after that you dose again and then therapy. So we leapfrog weeks, right? It could be as many as 16 total weeks with somebody. Some people go even longer. Some people see results after 4 or 5 doses. And then we take the whatever's left in their prescription and we turn it into maintenance dosing. It's all dependent on the person. That's kind of generally where we start with an every other week dosing regimen. Sometimes we have people dose every week. It depends on the person and what we're experiencing. Ketamine but when you're actually dosing, about a 2-hour event. Psilocybin, I think 6 hours, maybe 8 hours, 6 to 8, depending on how much you take. When you're really want to go and try the ayahuasca retreats, those truly are retreats. That's an 8 to 10 hour event, physically demanding. You must be under a lot of supervision.
Sure.
Ibogaine down in Mexico, that's like a 3-day event. Very challenging, but rewarding as well. So the ketamine fits into what most people consider an option, into their lives. Yeah.
So I think the other thing that we need to talk about is most people think psychedelics are like it's trippy, like you're going on like you're going to have a trip. Yeah. You're going to have a bad trip or a good trip or whatever.
Right.
And that it would absolutely include some visual experiences and that sort of thing. So let's segue into talking about kind of your experiences, and then we can talk about what other patients have kind of reported. But,
yeah, sure. Not everybody's going to have, I'll preface this by saying not everybody has had the experience that I've had.
No two experiences are the same, really.
Correct. And so like, and if you dose multiple times, you're going to get different experiences every single time.
Right.
Right. No doubt. But my experience, back to, the model of like Rick Perry, like if we were going to do this in our offices with our patients, I wanted to know what they were going to do. I didn't want to speak from a place of, well, I'm not going to do it.
But you should. But it's good for you.
Yeah, you should do it, but I'm not going to do it. Because let's be truthful, everybody, like to speak of what you just said, everybody has their different experience.
Sure.
Like we all got our own shit, right? We all got our baggage. And so something that has plagued me my entire life was that I've never felt like I belonged anywhere. I've always felt like an outsider. This permeates all through elementary, junior high, high school. Part of that is we moved around a lot as a kid. When I was a kid, part of that is just me, right? Never, ever felt like I belonged anywhere, which is really challenging because part of me really, really wants to belong. Part of me is scared shitless of belonging, right?
Sure.
Maybe a lot of people feel that way.
Sure.
So I'm like, okay, so I can bring some baggage, so to speak, some stuff. I don't know if I would call it trauma necessarily, but stuff I want to work on and be better at. So I get my prescription. I meet with my therapist /facilitator, and we talk. We talked for a good 30 minutes or so before we even began this process of dosing. We talked a lot about guilt and shame, which we don't need to dive into too deeply here because this isn't my therapy session. But
I could be your therapist.
You have been my therapist in so many ways.
Also, the reason you need therapy, but whatever, it's fine. It's fine. It's blurry.
But we talked a lot about shame and guilt and letting people down, and so she was extremely knowledgeable and helpful, comforting. And then we got to the point where it was time to dose. And and now mind you, we're doing this virtually, which is an option, okay, for some people. It's an option for our patients where we're still dialed in virtually. And I'm with you the whole time through the camera.
I just want to say that's not my favorite.
It's not my favorite either. It's not my favorite. It's not my favorite way to counsel people either, right?
Yeah,
I love the energy in the room when I'm with somebody.
Yeah.
I think they need that as well. We are wired to be connected. I mean, we are social beings, period.
Correct.
Whether, I don't care what the lone wolf out there says, right?
True.
But so we are doing this virtually, and she's watching me it dissolve and swish.
Mm-hmm.
Now, we've got the great music, right? We've got curated psychedelic music. I've got an eye mask. All the protocols are in place. You are there to take my blood pressure, which is an important part of the protocol. And as she's telling me when it's time to spit. This is a 12-minute swish, so it seems like a long time. It may seem like a long time. At some point, you don't care. All right. So those of you out there that are like 12 minutes, that's a long time. I've switched as long as 18 minutes. Promise you, at some point, you don't care. And then when I'm about to swish, she gently said, when you spit all the shame and guilt with it. Now, the ketamine flight has taken hold. So I sort of just nodded, right? My experience was filled with colors. First, everything sort of went black, and then my body had a rush to it, almost like I was falling.
That's the dissociation.
Yeah, I started to dissociate, right? It was like the dissociative effect was taking over. And then colors started popping, almost like those old kaleidoscopes that we look
You
like.
described it at the time like a 1990s screensaver.
Yeah, totally.
That's what you told me.
Remember
like
those
a Windows
like those
screensaver.
Windows screensavers
Yeah.
that sort of pixelated and then went in and out. And I was like, holy shit, right? And, maybe that was really impactful to me. I don't know. But like the colors were vivid. And at one point, I lifted my mask to look out of my eye, and I could see our room clearly. And then when I put the mask back down, I was right back into the image. Mm-hmm. Now, these images, though, that were being created in my mind were all massive rooms.
You always go to
beautiful
rooms.
architecture, beautiful colors, beautiful spaces, places I've never been before, but I'm watching them get created. Now, I don't know, like from a neuroscience standpoint, is that like my neurons are just firing and this is what neurons firing looks like? It's what it looks like for me. It was gorgeous. I remember at one point, now thoughts are coming in and thoughts are racing out, random thoughts. And I'm literally thinking when a thought comes in, go away, go away, go away. Because I wanted to, you do have that control. You're not totally out of it, okay? From your perspective, watching me at that moment, it probably looked like what? I'm just napping.
Yes, you look like you were napping.
Yeah, and all of our patients, when they're dosing in our office,
napping.
they just look like they're taking the greatest nap of their lives. And then about 45 minutes later, I started to feel less and less not this way. And I'm like, okay, I think I'm done because I'm not getting the same images. I'm not getting the same physical sensations. So I sit up. She's watching. Now she turned her camera off. She saw me sit up, so she turns her camera on. She turns her mic on, and she's like, how are you feeling? It was really difficult at that moment to verbalize anything.
Correct.
When I started talking, it felt like my mouth was not working. It felt like words were really challenging.
You were talking fine.
I know you guys say this, but it didn't feel that way. So I was still a little dissociated from reality of
Correct.
like,
yes.
Okay, things aren't connected. But we chatted, she and I briefly. I felt great. It felt really good, like relief. I didn't understand it though. I didn't understand. None of the things I saw initially made any sense to guilt or shame or any of the conversation we had about how I felt about myself. None of it. So we log off after about 10 minutes. She's like, can I call you tomorrow and we can process? And I'm like, sure.
You would have agreed to anything.
I would have agreed to anything. Like she would have said, yeah, exactly. Give me the keys to your truck.
Yes.
Okay. Yeah.
I love it.
Yeah. No, she wasn't like that, but I probably would have.
Yeah.
But
Totally
it was a pleasant, immediate debrief, but not everybody can debrief clearly right after they wake up, right after they come out of it.
It's true.
Sometimes they need a minute, they need more than a minute, they need 24 hours.
In contrast, there are some
some that are just chatty
talk
Cathy's.
the whole time,
and they're totally they're back and they're with it, and we have great integrative conversations immediately in that golden hour.
Yeah. Right.
The golden hour of neuroplasticity.
Yeah.
It's really effective for those that can. But it's okay if you can't.
Sure. Because
you might need a minute to process. I needed more than a minute to process. So we logged off. I shut my laptop and I started crying. I want to say it wasn't like a sobbing cry, but you said it was
you cried pretty hard.
It was a hard cry.
Yeah, it was.
So it was a hard cry, which I don't do.
Nope.
Like
you don't.
She can
Not
test
much.
this. I don't do this much. it was the first time in a very long time that I had a hard cry. In fact, I'm not sure I remember the last time I had a hard cry. Maybe when my grandmother passed. I don't even know if that maybe that was a long time ago. But they weren't tears of sadness, absolute tears of relief. I felt like I've been carrying around a bucket of tears forever. And I just emptied the bucket and I was like, damn, my arms feel good now.
Yeah.
My shoulders aren't as heavy. Things aren't as heavy. I feel like,
You feel lighter.
And then I have no idea why I said what I said. I mean, I know now why I said what I said to you. But I said to you out loud, I'm not the little boy that gets kicked out of the room anymore. And that was hard because I didn't understand it. Through my own processing afterwards, and through some examination of where did guilt and shame come from, conversations that you and I have had for many years about my upbringing, I realized that I didn't, and my dad, he died in 2022. I realized that our relationship was complicated at best, that my dad was loving and caring and an asshole and impatient and mean.
At times,
all rolled into one. And I realized that I had maybe a handful of good memories of him being a good role model, being very nurturing, but I had 100 or 1,000 examples of his impatience, his temper, me getting kicked out of projects around the house, sent to my room, him yelling and screaming, him getting mad, like he's helping me at the kitchen table with my homework, my math homework, and getting mad at me for not understanding how he's teaching me my math homework and throwing my homework across the table and sending me to my room.
Yeah.
I immediately flashed back to episodes of him not talking to me for weeks because I pissed him off or hurt his feelings or whatever I did.
Sure. And you were 10.
And right, exactly. And so that's if you grow up like that, one of the things that I learned was you don't belong anywhere, not even here. You don't do anything good enough, not even to your dad. And so easy thing to do is just don't risk anywhere or do anything. Don't fit anywhere. Because if you do, you're going to get kicked out. But I learned through this process, I don't have to be. And guess what? I'm not the little boy that gets kicked out anymore. And those visuals in that first session, those amazing rooms that I was building and creating the way I wanted them to be, they were mine. Sure. And I got to stay. And once I realized that, through other dosing experiences, so some work that you and I have done together that you've helped me with, I realized that I am chosen and worthy. And I don't need to worry about any fucking asshole kicking me out of any fucking room anymore.
It's true. You don't.
And it's changed me.
It has.
Now, I say that, and I get emotional talking about this, to say my experience is mine. It doesn't belong to you. And so it's not going to belong to any patient. They have their own. From having visuals that are completely in black and white.
Mm-hmm. We have had
visuals where they're underwater and all they see is black and white and rocks and they don't know what it means.
Right.
And we're processing what it means later. Visuals.
You may not see color at all. You may not have any visuals.
Clients that see words like a ticker tape across a screen and just words, but later understanding what those words meant. Clients that see all the important people in their lives on an assembly line across their face.
Sure.
And they're saying something or conveying something to that person. I've heard some people don't see anything right away. Some people are so afraid of letting go and feeling something new that's the message that comes out of dosing, that you won't let go. You
Sure.
you
You're not in
won't.
control of this.
You are not. Yeah. You, like, this is the one opportunity you have to be open-minded
Sure.
and release.
Sure.
And you're holding on to this too. So every dosing experience has something revealed, something. We just have to be open-minded and willing to surrender to it.
Well, and it's evident, like, this still kind of makes you emotional, right?
Yeah.
And so this is an onion that's big.
Sure.
And we have an opportunity to kind of hit a layer, but it's not a one and done. This is not going to be a, I don't know how old you are exactly.
No one does.
I'm going to say in your 50s. But you can't get that far in life,
I've had birthdays.
You've had some birthdays and experience the things you have, and then just like I Dream of Jeannie, all fixed. It's not going to be that quick, and I think sometimes that's what patients are looking for. They're looking for this kind of one and done, or this, and that's why the leapfrog method, I think, is so powerful, and I think that's why our patients have had good results, because there is that. We capitalize on the neuroplastic window. Every clinician has relationships with their patients. They kind of know where they're coming from. They know what the baggage is, and they know what they're looking for, and they can help make those connections.
That's right.
That if you don't have that relationship, it would be very difficult. And so I think that makes it powerful.
Yeah.
And I think it makes it worth exploring. It's not going to be for everybody. That's the other thing.
Correct.
But if I guess what should we do if somebody's interested in this, or somebody is?
Yeah.
What's the process?
If someone is interested and they're already in therapy, I think they have the conversation with your therapist, get their take on it. I am a believer in the way we do it. I don't think I would want personally to go on a scavenger hunt for some puzzle pieces, take 2 or 3 puzzle pieces that don't make any sense back to someone that didn't go on the hunt with me, and ask them, what fucking puzzle do these fit?
Is this a landscape?
Yeah, right.
What is this?
Exactly.
Yeah.
Right.
Got it.
I want that person with me. So I think the standard is find a therapist that also is a ketamine-assisted psychotherapist that understands what ketamine could reveal, could open for you, and it's going to be with you the whole time. You're going to see a lot of, that's why I think the spiritual aspect of like a psilocybin ceremony or some sort of retreat model works, because that person is with you. They understand what it can do for you, and they help you process it. It kills me that there's really good clinical trials out there, and in this world, we have to start somewhere. And so clinical trials are how we get to somewhere better. But there are clinical trials on some military bases right now where the patient goes in, is administered a psychedelic, and their therapist, they can't see anyone for 3 months, and you're losing that window. I personally believe we taught that leapfrog method, but it's stacking neuroplastic window on top of neuroplastic window on top of neuroplastic window. So now if we went the whole 16 weeks, you have 16 consecutive weeks of a neuroplastic opening. If you had 16 weeks in the gym, 16 weeks on a diet, 16 weeks in a course, 16 weeks of learning anything or doing anything with different, like
you're going to get better at it.
You're going to get better at it.
For sure.
You're going to have a different perspective.
Yeah.
You're going to change.
Yeah.
Change. And you say this over and over again, change, and you're so right. Change is not an event.
It's a process.
It is a process. This is a process. And, you can go do ibogaine and go do ayahuasca, and that is a big event in your life. It's a big event.
But it's still a process.
The process of change is on you. You are the fucking artist. So be the artist you want to be.
Right.
Period.
Right. So I guess the last question I have, because we're running out of time, but who is this really,
Mhm.
do you think this is the best for? Who would you recommend? Because typically we
Yeah.
don't walk out and recommend a psychedelic.
Yeah.
You need psilocybin.
Yeah.
Nope, you need ibogaine. Like,
Well,
that's not the way that works.
I only do that at Walmart.
Like, here's my card.
Yeah.
Really?
Yeah.
Here, take
No.
this.
It's a really good question. I think the ideal client, the avatar client for psychedelics, for ketamine, is someone who is that understands that they've been stuck for a very long time. They may describe their lives as being in quicksand, being stuck, being frozen, being paralyzed. Something is driving that: stress, anxiety, depression. It's someone that has been feeling hopeless, helpless, and defeated.
Or a victim to
Yes,
some,
something.
like the loop,
Yes.
like they're in a loop that they
Yes.
just can't get out
Yeah,
of.
if you've had an event that has happened, you're having negative thoughts, counterproductive thoughts that lead to harmful emotions and reactions, and that harmful emotion and reaction brings you back over here, and we've got this loop, and from a brain standpoint, your neurons are getting damaged by maintaining high stress levels, high trauma levels, high anxiety, high depression, your cortisol levels through the roof. Your neurons are literally getting damaged. And when your neurons are damaged, they can stop working.
Sure.
And they atrophy and shrink. And you literally are not firing in all cylinders. And if you feel like you are stuck and you are not firing in all cylinders the way you want to be, if your canvas is not what you want it to look like, then it's for you. Explore it.
Yeah.
Explore it.
I think that the other thing that I've heard patients say, is, I can think of two, is that they did not intend to have to take medicine for the rest of their life.
Correct.
They want to be free from that.
Somebody intended for you to take medicine your whole life.
But they did not,
But they
right?
did not.
They did not
Correct.
want that consequence.
Correct.
And they are like, I've been on this medication for 30 years.
Yeah.
I've been on some form of medication
Yeah.
for 30 years.
Yeah.
And I still feel flat, or I still feel like I'm a 5 every day.
Right.
And I don't want that feeling anymore.
Absolutely.
And so for those patients, I think I've had people say, well, I'm already taking this medicine, I can't. That is not accurate. You
Right.
can still do ketamine, and there is a process
Right.
for weaning you off of those medications and eventually eliminating that. And we have a couple of patients who are
Absolutely.
in that process, and one that has completed that process
Right.
and is functioning,
Right.
and is not reporting adverse effects,
Right.
and is happy and healthy and all those things. So I think that's also something that you need to discuss. If you're under the care of a psychiatrist, make sure that they know that, because
Absolutely.
there is a possibility that you won't need them anymore.
Absolutely.
for
Our
that.
goal, ultimately, for those that have been on medications for many, many years, is to throw them in the toilet. But you can't just do that day one.
Right?
We go through this ketamine protocol, maybe 8 doses and 8 therapy sessions. Maybe we go as 8 more, go 16, which is a long time, right? But eventually we start talking about, let's cut this stuff in half and let's get rid of all of it altogether. You're talking about people that have been taking medication for years and years and years. It's going to be very challenging to just say, let's get rid of all of it. Sometimes it's not physically the right thing to do anyway, to
Sure.
just throw everything in the toilet. But we are trying to get rid of it. And because it breaks my heart to have people say, I need these pills the rest of my life just to feel a 5 out of 10 or a 6 out of 10. You should be living a 10 out of 10 life.
Agreed. 100%.
Yeah. And that little pill that you get, there was somebody else is profiting off of your insurance or hard-earned money. That's bullshit. When did you think it was going to fucking work? It doesn't fucking work.
But if you
it
don't
fucking
know,
maintains.
right? But if you don't
Right.
know that, right, you
Right.
think this is the best life has
Right.
to offer me,
Right.
right? And
Yeah.
I think that's what I'm most proud of. I think is that really at Mindset we're trying to help you live your best life,
Yeah.
be your best
absolutely.
self, right?
Absolutely.
Put the bags down,
Absolutely.
leave those here,
Yeah.
go live your best
Well, stop
life.
carrying those buckets.
Yeah,
Stop it.
live the 10
Yeah.
out of 10 life.
Absolutely.
And so I think it's worth exploring for sure.
Absolutely. It's if anybody is interested, start with just having conversations. Don't just trust the internet,
No.
and research where you're getting it and how you're going to get it delivered and how you're going to implement that. there's a lot of research out there, a lot of great books out there that you can read and learn more about it. But don't join in to this medical idea of I can go in and get it and go home. Okay? Because that can be it can be very dangerous, and it's definitely not effective.
All right. That's all the time we have for today. Thanks so much for joining us for Unfiltered Counseling. See you next time.